A county health department is urging doctors to quickly report possible measles cases as more are starting to show up in southwest Kansas.
Yeah, they say don't wait on a test. Fox 4's Reagan Porter live at the Johnson County Department of Health and Environment. Reagan?
He told me this is concerning and they're watching the numbers. Cases in Kansas have jumped over the last 4 weeks. Take a look at this measles outbreak dashboard. As of Wednesday, 32 cases have been reported in southwest Kansas. That's up 8 from last week. One person has been hospitalized. A majority of those cases have been unvaccinated people.
The best way to prevent measles is through vaccination. The measles vaccine is highly effective.
Charlie Hunt is the director of the Johnson County Department of Health and Environment. He's asking healthcare providers, including school nurses and daycare workers, to report any probable case of measles within 4 hours to the Kansas Department of Health and Environment. Hunt says no need to wait for test results, noting the disease is highly contagious.
Unfortunately, once measles gets into a community, it can spread pretty rapidly among people who are not vaccinated.
Here are some symptoms to look for: cough, runny nose, high fever, and red watery eyes. Dr. Todd Fristo with St. Luke's Physician Group in Independence also says a few days later, people may develop a rash.
Be aware, but I don't think we should panic or overreact. And, if you've had, 2 MMR vaccinations, your risk is really very low. If you haven't had the vaccinations, just be aware of what's going on around you.
Fristo says still the best protection is getting vaccinated. Nationwide, only 1 to 2% of the cases were reported in people that had the full vaccination series. Hunt says 2 doses of the measles, mumps, and rubella vaccine are 97% effective against measles. Doctors typically recommend children get the first dose at 1 year old and the second between ages 4 to 6.
If an infant is going to be placed at risk, so if they're traveling to an area where measles is going on or traveling internationally, they can be vaccinated starting at 6 months.
Hunt says adults born before 1957 are generally considered to be immune because before then, measles were so common. And if you have any questions about getting vaccinated, of course, talk to your doctor. Lauren?